Hi, welcome to our webinar on reimagining the patient experience. My name is Ed Marx, and I serve as the Chief Digital Officer for Tech Mahindra Health and Life Sciences. And if you've been part of our webinars before, you'll remember two key things about what we do. The first is we love to engage with you, so we're live. So you know how to use sort of the chat box question function. We'll take your questions live and answer all of them that we can. We also receive several ahead of time, and we plan to address those as well and weave those in. So please engage with us. And the second thing, by being live, it makes it kind of fun because you never know what's going to happen. And we've certainly in this past year have had some really interesting things happen while live, but it's all been good. So I'm just really excited to talk on this topic. It's been a topic we spent a lot of time on last year as well, because it really is critical, I think, to the success of all organizations, whether you're a payer or a provider, but it really is about patient experience. And I think everyone pretty much knows the definition of those sort of things, so we won't spend a lot of time there, but try to get more practical. So we know that there's a higher expectation today than ever that customers, consumers, we call them patients, have higher expectation, like they want to replicate their experience they might have with Amazon as a classic example. One button, one touch, really simple. Now everyone knows behind the scenes it's probably pretty complex, but to us as consumers, it's pretty easy. And that's really what we all strive to do in terms of the healthcare experience, because it's already a drag. The fact that you're even needing healthcare is usually not a most positive sign unless it's wellness. So the easier we can make it, the better for everyone involved. So today I'm joined by Greg Miller. He's the Vice President of Healthcare Strategy at TalkDesk. So they're really good at this sort of thing. So I thought it'd be great to have Greg. Plus, I've known Greg for many, many years, and this has always been something that we've spoken about, maybe in different words depending on the era, but something we've talked about a lot. And Greg's also a good running buddy of mine. So whether it was at our professional organizations where they do, 5Ks or 10Ks or something like that to raise money, some charity runs, or whenever we're in the same town together. I think the last time, Greg, it was Cleveland, and we met in front of the Cleveland Rock and Roll Hall of Fame, and we went running for a while and just got caught up. And so it was a great way to not only exercise, but also just to catch up professionally. So, Greg, welcome. Tell us a little bit about yourself.
Well, thanks for having me, Ed. Appreciate it. So I've been in the healthcare technology world forever, and had the pleasure of working with you both as a friend, a partner, and a customer. So it's been fun. But now I'm at TalkDesk, and we are all about reimagining the patient experience. Lord knows we need to rethink how we're really addressing the patients and members and others. So excited to be here.
Yeah, and it's funny, we were talking about how as we age, we ourselves are becoming more and more, especially since we're both really active skiing and cycling and running. As we age, we're definitely getting a lot of the patient experience ourselves. It used to be like 10, 15, 20 years ago, it might have been more theory, but now we're actually experiencing it ourselves, which is helpful because we can empathize and also get new ideas, and a lot happens. And I know, Greg, for you, something pretty dramatic happened on Christmas a few months ago. Can you share a little bit about that and weaving that into this whole theme of reimagining the patient experience?
Yeah, I had a fun Christmas. I spent 6 hours in the emergency department. And so on Christmas morning, went out skiing with my family, just it's a tradition we always do. And I ended up crashing and breaking 3 ribs. And that's what led me to the emergency department. And during that experience, the actual caring process was great. It was wonderful. But what happened after was, I'd just say, could have been better. And in a sense, essentially what happened was when I was being discharged by the emergency department doc, he said, your primary care doc will reach out to you within 2 weeks for a follow-up appointment. Well, 2 weeks rolls by, 3 weeks rolls by, 4 weeks rolls by, and I don't hear from anybody. And not an email, not a text, not a voicemail, nothing. And so I'm like, okay, well, I'll jump on the phone and I'll call the clinic. And so I jumped on the phone, I called the clinic, and it was 43 minutes on hold. And I never got to talk to anybody because I had to go to another meeting, so I hung up. And then I'm like, okay, well, I know they have a mobile app, so I'll just go there. And so I start clicking through the different, screens in the mobile app. Ultimately, get to the very last page, and it asks me, what was the reason for my visit request? And I said, follow up from broken ribs. And then on the app, the app was just broken. There was no way to hit next or enter or anything. It was just dead. So then I go onto the website and I start searching for, can I text anybody? Can I chat with anybody? Can I even send an email to somebody? And there was none of those options available. So, as a consumer who's used to dealing with companies and organizations in a multi-channel way, it was very frustrating for me. And to this day, we're almost 9 weeks later, and I still haven't heard from anybody. And fortunately, I'm okay. But I think the bigger issue is that imagine if I was, I went to the emergency department with cardiac arrest, and there was, supposed to be a series of follow-up appointments. I never heard from anybody. The outcome could be a lot worse than it is for me. So, yeah, unfortunately, Christmas Day was not all that much fun.
Yeah, I'm sorry that that happened to you. And like most good people, you use that to inform your own experience, your own evaluation of that experience, and how that helps you as a professional in healthcare to help bring about change. And the organization, of course, we'll never talk specifically about the organization, but it's pretty a progressive organization. This wasn't like you were in the middle of nowhere. So this was an organization that's pretty impressive and does a lot of great things for their patients and their communities. And even then, the patient experience was really difficult. And that's really my only point is we're not just talking about a one-off thing here. We're talking about in general that this is a obstacle or challenge that many still contend with. And again, why we're having this conversation to begin with. And we want to get really practical, and that's certainly what we plan to do. But I thought the fact that this experience happened to you such a short time ago and is so relevant to the conversation that we'll definitely weave that in a little bit. So when you juxtapose that, Greg, you mentioned some other experiences where it's much better, like in other industries. Are there a couple examples that you might give? And I know people get tired of, oh, we can't compare us to other industries, but I think actually we can and we should, because then we can take their best practices and bring them over. So are there one or two companies that you interact with in other industries on a regular basis that you think we could take a lesson from?
Yeah, I think, people, the common ones to refer to are Amazon or Uber, where I can order a car just about any street corner in the world. And those are all great experiences. But I'm going to steal one from my friend Ryan Smith at Intermountain Healthcare because I was on the HIMSS Dallas chapter webinar a few weeks back, and Ryan was on there and he was talking about the patient experience, and he referenced Delta. And prior to COVID, I was a very frequent flyer for more than 30 years, and I love Delta because if for example, think about it, I just fire up the app, I can book anything, I can order my meals ahead of time. I can, once I fly, if I have a delay, perhaps we're delayed in the air, once I land in the airport, I'll either the flight will be already booked for me on the next available flight, or I get a phone call. And the phone call is, hi, Mr. Miller, are you in the Detroit airport? Yes, I am. I'm working to rebook your flight. And I think the key in there is that it's proactive, it's personal to me, and it's not waiting for me to go stand in some line inside the airport for the customer service desk to rebook my flight, or having to call Delta and sit on hold and try to rebook it that way. They're way ahead. They're already one step ahead of me. And so I think things like that, Delta experience. You even think about how Zappos had reinvented the shoe buying experience and how successful they've been over the years. So I think there's lots of examples out there of, and I shouldn't even refer to them as examples, right? We as people are very comfortable and very used to interacting with these companies and organizations in a multi-channel way rather than voice. I think actually on that webinar, Ryan even mentioned that he considers it a failure if he has to call an organization. And I think that was a really good way to sum up what we have come to expect from, from organizations and companies in today's era.
Yeah, that's a really good example. So we're going to continue to get practical. And just a reminder, we are live. You can ask questions. We're going to hit some of the pre-questions in a second, but I'm going to ask about some best practices, and we'll take a pause halfway through some of these best practices that anyone can apply in their as a provider or as a payer. And then, yeah, like I said, hit some questions and any new ones that might come up. So let's start about talking best practices. Greg, do you want to bring one up, and maybe we can chat a little bit about it?
Yeah, I mean, I already mentioned Delta, but let me give you a real relevant example that a friend of mine told me about recently. It was just the other day, and he recently he needed to have a surgical. He needed to have a procedure done, and so he was actually going to shop it around, and went to a major health system in his market, and got a price, and then shopped it around to a few others, and ultimately came back to the major health system because he had been there before and that type of thing. And so when he asked about the price, they gave him a price. I don't remember the exact number, but after he had his procedure, he gets a bill for 4 times that number. And so, he's questioning why did I get a bill? And he ended up having to, why is it 4 times what I was expecting it to be? He ended up having to call 3 different organizations because they billed him separately for the estimate that he originally got was only for the technical component, for the hospital component. He got a separate bill for the physician component, separate bill for the physical therapist, and so on. And so he had to end up calling each individual organization to resolve the billing issue. Now, if you imagine this, right? Imagine going to a restaurant and you order whatever you order, and you get a bill from the waiter for their time. You get a bill from the busboy for his time. You get a bill from the person who cleaned your table, so on and so forth. Unfortunately, you'd think that was absolutely a crazy experience, right? If you were in a restaurant and that happened. But in healthcare, we tolerate it, right? It's just part of the deal. However, our expectations are this can be like a restaurant where I'm going to go have a nice time, get one check, go on the way. So I think just on a practical level, that's just an example of how we need to evolve.
Yeah, so I would categorize that sort of as human-centered design. So a best practice would be human-centered design, and an example of that would be what you just shared, Greg, is making the complex simple. Sure, there's different people you need to pay on the back end, different organizations, but for the customer, just give them a simple to understand bill of their services. And I think the restaurant example was good. And we can do this. And I know some organizations and some payers have done this to great satisfaction. So that's a really good example. And I think related to that is really about making experiences personal as well. So if I were to just glomp onto your example at the restaurant, even a small thing, sometimes the waiter or waitress will put a personal note on the receipt. Mm-hmm. I always admire that because it only took them a minute, but they took the time to maybe know something about you, know your name, said something personal. I just think that personalization, it actually helps draw me back to that restaurant because I'm like, they're really nice there, they're really kind there, and they know me. And so we do frequent certain restaurants, and certainly the ones that really get it, they know us, they know our names, they welcome us. They're like, oh, we're so glad to see you. We had that experience on Sunday night when we went to our favorite Thai restaurant here in Dallas, Fort Worth. And so personalize it. And, I think about Disney. So I may have given this example before in one of our webinars, but it's such a good one. And it's 5 years old. And I still don't see it being replicated very much in healthcare. But they give you a band. You get the little Disney band, and it's cute, and it's, the kids love it specifically. But it has everything on there you need to navigate Disney. Whether you're buying food, getting on a ride, everything is on your magic band. But the best part was, I remember our youngest daughter was with us. This trip was especially for her, and we were going through one of the rides, and on the marquee in the ride was a welcome from Mickey, and with her name. Hey, welcome, Shalini, to your first, because we had let them know ahead of time when we registered. It was her first trip to Disney. It was personalized, and she'll never forget that. She still talks about that today. You know, she's a teenager, about to graduate from high school, and she still remembers, like, when I turned 13 at Disney. And so why can't we personalize things in healthcare? So really making the human-centered design one of those keys. Now, speaking of human-centered design, Greg, another best practice, and maybe you can talk a little bit about this, is including patients in your processes. You know, how might someone go about including a patient in their processes to enhance the experience?
Well, I think I would personally love to be involved in a focus group about, you know, re-engineering the patient experience. But, you know, every organization knows who their populations are, right? And picking, you know, what depends on what type of experience you're trying to design, right? If you're trying to design something for the, you know, an elderly crowd, and, you know, going from the acute care hospital into home, and that's one use case. And you have others which are simple. I need to go get my annual wellness check. So I think thinking about the different aspects of care, care delivery, and focusing the population of people, or identifying the population of people that would fit that criteria, and having a virtual focus group. I think one of the, you know, we're all used to being on Zoom meetings all day long these days. And even the concept of, and I've run a lot of focus groups recently, you know, historically, I think the concept was you had to get everybody in a room. I think one of the advantages, and this is a positive out of COVID, is we're all much more comfortable using virtual or having virtual meetings. And so you can get to a lot of people. You can include many more people into a focus group that way than you can with a physical setting. So I think, you know, just identifying what processes you want to focus on first, identifying the populations that pertains to, and then the outbound outreach to those populations to get them, you know, to participate. There's lots of different ways to do that.
Yeah, so one of the first questions that you should have if you're evaluating a vendor for, I don't know, anything from digital front door to remote patient monitoring, whatever you might be thinking about, or internally, some self-development internally, is ask whoever is presenting what patients have informed this product. And if the answer is none, then turn away and go to a different source, whether it's internal or external, because you need to include patients in the design of everything, whether it's physical design, whether it's, you know, the digital era. It's not that hard to get patients who are willing, desiring to give you this free feedback that's so critical. And Greg, you know, even though we were talking about your experience over Christmas and how that informs, you know, both of us, our medical experiences, how that informs us in our day-to-day work, it still isn't the same when we look at ourselves, because that's often what we hear, right? People say, well, we don't have a patient, you know, we're all patients, or we have family members that are patients. It's not the same, because we have filters because of our experience in healthcare, working in healthcare. So go out, work with, depending on your organization, you may have patient advocacy professionals or patient experience professionals in your organization, whoever's responsible for that area, the volunteers. I've worked with both, depending on my organization. Get out there and find some patients, and the feedback will be invaluable, because at the end of the day, they're your users. Greg, talk about another best practice, and then we're going to jump into some of these questions. Another best practice has to do with omni-channel, right? Mm-hmm. So as much as we are digital, and there's a whole segment of our population, right, that's now digital native, talk about the omni-channel experience and how that needs to inform us as we reimagine the patient experience.
Yeah. So a couple thoughts there. One, we just actually did a extensive research report where we interviewed over 700 patients and over 150 patient experience professionals. And by the way, you can find the research report on our website. But one of the statistics from there that I think is interesting is that when the patients were surveyed, only 28% of patients felt that provider organizations could service them in a different channel other than voice. And yet 78%, I think is the statistic, have the expectation that they should be able to interact with a healthcare organization in a omni-channel kind of way. So I think the important thing to think about is, one, what are the channels that people want to interact with the organization on, and then also meet that person in the channel in their preferred channel, whether that's text, email, chatbot, virtual agents, live agents, whatever. Being able to communicate with them in the way that they want to be communicated with. And I think we see this all the time, right? The over 65 crew wants to often pick up the phone and call, but you have the millennial generation that doesn't want to ever talk to anybody. They want to be able to text or chat or things like that. So I think really thinking through who your populations are and your target audience and building the channels. I think one of the things, Ed, that I see out there as I talk to a lot of providers is, and I think about the contact center. Obviously, that's the perspective I'm thinking about things right now. But I don't think of the contact center as the focal point. I think of contact in a much broader sense. And when you think about the interactions that a person or a patient may want to have, thinking holistically in a way so you can synergize all the different communication channels. And what we often see is that an organization may have a contact center and they say, oh, well, I need a text capability. So they bolt on a text capability. Oh, I need a chatbot. So they bolt on a chatbot. What happens in those situations is it's not integrated. It's not integrated with the EHR, but it's also those channels of communication are not integrated. And so how can you expect to have a seamless patient experience if the channels through which the communication is happening are not harmonized? And I think that's an important thing to think about as we reimagine the patient experience.
Yeah, that's a great point. And so we've hit three. We're just trying to be really practical. We hit three best practices. We have got a couple more to go, but I'm going to hit the questions now. But it really is include your patients in all your processes and design. Meet patients where they are. So while we all love digital and huge proponents of it, obviously, you've got to be multi-channel in your approach, multimodalities, and then make the experience personal. So that's really key as well. So I wanted to get to a couple questions. So as we're in this digital age, one of the questions is, how do patients expect to engage with healthcare in the comfort of their home? So it's well established that we're headed towards hospital at home, ultimately, right? We're moving away from brick and mortar, won't disappear, but whether from a payer perspective or providers, because I see payers very active in this space as well as providers. So we are definitely moving to the home. So Greg, ideas on engaging, how consumers want to be engaged with in their home?
Yeah, so there's one company I know that is doing some really cool things by engaging people in their homes over their television network. And anything from patient education to identifying gaps in care to managing the pathway, the information comes direct through their TV provider. And I think that's a very effective way to get to that last mile into the patient's home. Other companies are working on or have devices that are in the home that communicate digitally back to the provider organization. So I think, whether it be sensors in the home or coming through your TV or even just telehealth, right? I mean, we're very comfortable in these kinds of settings. And I don't need to, the visit I was trying to schedule, where I wasn't able to schedule, I was trying to schedule a video visit. I don't want to go into the clinic right now. So I think there's lots of different ways that we're, and I think, again, thinking about best practices in other industries is essential to reimagining how we can interact with patients, whether it be in the home or anywhere else.
Yeah, and again, to the point made earlier about being bimodal, you're right. Some people will just want, give me some IoT type device, something non-intrusive, but there. And others, they still want that phone call. And in fact, in the demonstration projects that have been recently approved, you still have to check in once a day with your patient. So be bimodal. Another question that came in, and Greg, we're down to what I would call the, excuse me, I'll call the rapid fire round because we're down to about 4 minutes.
Okay.
So what if you're a small team? So a lot of payers and hospitals only have a small dedicated team to do things digital or patient experience. How do they make most of their effort when they're a small team? I mean, what is an idea or two that might pop to your head?
I start with the patient. I mean, I think many organizations, they just focus on, the inside, right? What do they want to do? But start with the patient. That's your customer. Start with their perspective.
Yeah, so exactly right. So you just multiplied your team by including a patient. That's one thing. The other thing is partnering. So I always found it beneficial when I was a CIO to partner with other organizations. So it could be a peer organization. So maybe a non-competitor, and that's another way. And the other thing is to partner with a vendor that you trust, it has good aligned values. So that's really good.
And I might also add, the team makeup there, I think you're starting to see this more often in healthcare, is people, executives coming from other industries like a Disney, and having a team of people, the makeup of that team, have different perspectives that are outside of just healthcare.
Yeah, and that's number 4 best practice, Greg. Thanks for bringing that up. And that really is to leverage other individuals from outside healthcare. So upskill your team, because if you don't upskill your team, someone's going to upskill for you, and you may or may not be included.
Yep.
So let that sink in for a moment. If you need any other sort of, that shouldn't be the motivation, but if that's what it takes, think about your longevity. And you have to, in our roles today in leading digital, leading healthcare organizations, you need to continuously evolve yourself. If you rest on your laurels, that's not going to cut it. It's not fair to the patient. It's not fair to your organization. So learn more from other industries, bring in people from outside of healthcare. And that was your point. And we've seen that happening where, not by choice, but we've seen some CIOs and CDOs come in from outside of healthcare. And I think it's good, absolutely. But I also think it's a sign for everyone that you need to continue to upskill. So the last sort of best practice, because again, we wanted to be really practical for everyone. The 5th thing, and again, we take these from other industries. The 5th one is, this one crosses industries, but develop a plan. So Greg, I mean, what's your experience? Do you think most organizations have a plan to address patient experience, or do they sort of wing it, or what sort of advice might you have there?
I think some organizations have an overarching plan, but because of the nature of healthcare being so siloed and fractured, the mission of that plan doesn't resonate all the way through the entire patient experience. And so I think, the planning process, right, you got to set a baseline. So get out there and measure, what your patients are feeling about the organization and their patient experience, and then build a plan to make it better.
Yeah. So yeah, it's like anything else. If you don't it's the process of planning actually brings the most benefit. And so you should definitely work on a plan, bring the organization together, include the patient. And we have one last question we're going to take, and that is, how can outside organizations connect with patient groups? So what I would suggest is that, I'm assuming by outside organization, this is not a payer or a provider, but perhaps a vendor, someone in this space, or a consulting agency, is I would connect with a payer or a hospital that has a need, and connect with them, and then work as part of that partnership to leverage the ability to access their patients that want to be involved in this sort of research or focus groups. I think that's one way of doing it. I mean, another way is go direct to the market, but you might have a trust issue, might be hard to do. But I think, if I had a vendor, and I had vendors come up to me and say, Ed, we're trying to figure this thing out, we want to provide this service, and here's the benefit to your organization, can we have access and in a controlled environment? And yeah, you can certainly do that. Greg, we have 1 minute left before we are 30 seconds. So I don't know, give you a 30-second window if you had any other comments.
No, I don't really have any other comments other than think different. I often look at quotes from Steve Jobs and really think about things like that. And I think, I've told you before, Ed, there's this concept of thinking outside the box. Well, I tend to think about patient experience within the realm of there is no box. Let's start over. Let's just think different and apply it to the world in which we know a lot about. And I think there's lots of opportunity to step outside our traditional roles and that type of thing, and just think different.
Yep. Greg, thank you so much.
Thanks for having me.
Appreciate all your wisdom. We talked about 5 key things, so very practical, and then also from a personal experience. So I hope you enjoyed that. Coming up in the next couple of weeks is more webinars. So what can we learn from other industries? So we're going to have someone from a telco. This is interesting. This person is leading a telco company that's a small company taking on Verizon and AT&T and beating them. So what can we learn from them? We're going to talk about patient centricity with Dr. White from WebMD, who's also with the Discovery Channel. We're going to talk more finance perspectives, and our series on race relations continues as well. So that's something that we're absolutely committed to. And then also, in case you don't know, this is the only commercial that we have ever done, and that is there's a podcast called Digital Voices, and it drops every Wednesday on Spotify, Apple, wherever you get your pods from, and I like it. So far, so good. So please listen. Thank you for being in our audience today. It's been a real joy to connect with you, and we look forward to the next time we interact. Take care.